people around me, my employees and peers, really thought I was potentially dying. I looked like I had cancer. And I went from doctor to doctor in the allopathic model, and I didn't get any answers. So then I started thinking outside the box, went to, a whole bunch of different kind of people approaching the body differently, everything from acupuncture to a naturopath to herbalist, just, some doctors that were doing leading edge immunotherapy. And then I was reading everything I possibly could get my hands on. It was before the internet. So it's like lots of different
I mean, there's an element of desperation there, right?
Oh my gosh.
And I'm going to guess, and I think you're going to shake my head and go, yep. But I bet you a lot of people were saying, well, you're just stressed.
Oh yeah.
Right.
But I wouldn't accept that because
well, good. Because a lot of us, I mean, and you're working at IBM. It's a high stress job, this and that. People are like, oh, you just got back from vacation. You're just stressed out coming back to work. I'm sure you heard that. And good for you that you're like, okay, yeah, I am stressed. Who isn't these days or even those days? But you took it to another level.
Yeah. So I think about stress as changing the threshold of how things work in your body, but I don't think about it as being the main trigger for an event like that.
Right.
And so I'm sure it did play somewhat of a role, and I'm sure it's played a role in my other health journeys as well. But it gets to be a feed forward loop, right? The worse you feel, the more stressed you feel, right?
Right. That's actually a great point. And then it's just like, you're circling the drain and you're just kind of going round and round and round. It's frustrating. So you decided at that point, you're like, okay, I want to become a healer. I want to go into medicine. So you were one of these people when I was in med school that I remember seeing like parents in med school. And I thought to myself, how are they doing this? Because I'm barely getting by and I just have me. And you were a mom at this point, right?
Well, I actually was pregnant during my second year of med school, had my first child right during the first rotation of third year, when you start.
Oh my God, that's amazing.
And here I'm 34 at this time. And so,
wow.
advanced age for medical school. And then, running around having babies. And then I had my second. I was pregnant during the second year of residency, and then he came right at the beginning of third year of residency. So that put so to go from where you're, you feel like you're practically dying to be well enough to have babies at 34 and 38 in med school and residency, where you're, not getting sleep every third or fourth night. It's pretty amazing.
I bet.
That's just one of the things about how incredible the body is and the capability of healing.
It's incredible. So I think one of the most important things in terms of sort of foundation and scaffolding for what we're going to talk about is you hear the terms functional medicine, integrative medicine, alternative medicine. So can you kind of break that down, briefly for us in terms of, so people have an idea of like, when you hear these terms, what does this actually mean?
Mm-hmm. So I think about alternative medicine is it's kind of a slang term that's really anything other than allopathic. So, MD, here's the drug, here's the test. Integrative is more putting things together, like considering adding in acupuncture or considering adding in herbs, meditation, all these other modalities of healing in whatever particular way that the patient and the practitioner want to put them together. And then functional medicine is more specific. It's a particular framework that is very science-based and looking at systems biology. So looking at how one organ system affects the other. Like, you can't just look at what's going on with the heart. It's really what's going on in the whole body, the endocrine system, the immune system, and all of these things working together.
Gotcha. Okay. Now we're going to dive into mold, but I want you to talk about your personal journey with mold. I mean, this was a major deal. So let's kind of talk a little bit about that first of all.
Yeah, so I was trucking along. I had started my functional medicine practice and was into it several years. And I was starting to look for where else can I get additional continuing medical education that actually helps me to be a better doctor in this realm. And I had gone to Dr. Bill Ray's environmental health conference. And it was the first time I'd ever heard anything about toxic mold being a factor. We're not taught about that in medical school.
Right.
And, you can get aspergillosis in your organ systems, especially in the lungs, right? And
Right.
I was like, I think I've been missing this in some of my patients. So I went back to practice and I was like, oh my gosh, there are 3 or 4 patients that I think have toxic mold. And it was kind of an introduction to toxic mold, but there wasn't a really good philosophy for how to approach the patients. It was just more like, here it exists, and here are some of the symptoms to be looking for. And then about 9 months later, I started to have some really strange symptoms. And
Oh,
it didn't dawn on me that this could be me because it was so early in my understanding of mold. So, I went to my most trusted allopathic colleagues. I went to a neurologist. I went to an infectious disease specialist. I went to a rheumatologist because I was having so much pain in my body that it was hard for me to even have my kids hug me. I couldn't wear heels anymore because my foot was bothering so much. And the most concerning thing was, well, other than my hair falling out, and I was, it's like, oh my God, I really,
that's concerning. I would be concerned as well.